Welcome back to my live stream. The last stream got cut off because I was using an app. It didn't work out. Whatever, the app is gone, so hopefully this video quality will be a little bit better. But like in the last video, I was talking about dysautonomia. I know I'm saying it wrong again. It's about dysfunction of the autonomic nervous system. So I'm going to explain again what dysautonomia is, and then I'm going to get into a little bit about the autonomic nervous system and dysfunctions of the autonomic nervous system, and how that relates to my various issues. So basically, dysautonomia is an umbrella term that's used to describe several different medical conditions that cause malfunction of the autonomic nervous system. The autonomic nervous system controls the automatic functions of the body that we don't consciously think about, like your heart rate, blood pressure, digestion, dilation and constriction of your pupils, your kidney function, body temperature control. So people living with various forms of dysautonomia have trouble regulating these systems, which can result in lightheadedness, fainting, unstable blood pressure, abnormal heart rates, malnutrition, and in severe cases, it can even cause death. So let's go back to the basics of the autonomic nervous system. So in order to understand the various forms of dysautonomia, back up for one sec. One type of dysautonomia is POTS, P-O-T-S, which stands for Postural Orthostatic Tachycardia Syndrome. And when I describe that I have trouble with like lightheadedness and all of that when I go from lying down to standing up, that's the lying down to standing up is the postural part, your posture. And then the orthostatic tachycardia. I know the tachycardia part is your increased heart rate. So that's what that whole thing is. But like they said, there's more to it than just feeling dizzy or passing out when you stand up. So we'll talk a little bit about the autonomic nervous system and the different functions that it controls. And then I'll go back to talking about dysautonomia and the symptoms of it and how it affects my life. Hi, Pat. I just noticed that you're here. Thank you so much for joining. Okay, so like I said, in order to understand the various forms of dysautonomia, it's a good idea to learn a little bit about the basics of the autonomic nervous system, which we abbreviate ANS. The autonomic nervous system is a very complex system of nerves in the brain, spinal cord, and peripheral nerves that reach out to your limbs and organs. So, our nervous system is the brain, the spinal cord, and then from the spinal cord, the nerves extend out to all of our extremities and everything. So the autonomic nervous system can be divided into three main areas, the three that I just mentioned, and where they're located. So I don't really want to get into too much. I'm just going to say the names. They're just different parts of the brain, the medulla oblongata and the lower brainstem, and then you also find it in the hypothalamus. So these are the different areas of your nervous system that control these different functions. But two portions of the autonomic nervous system are actually found in the peripheral nervous system, the parts that extend out to our extremities. So those are the sympathetic and parasympathetic nervous system. So the medulla oblongata is a part of the brain that regulates cardiac, respiratory, vasomotor control, as well as your reflexes like coughing, sneezing, vomiting, and swallowing. And the hypothalamus is another part of the brain that performs a supporting role by linking the nervous system and the endocrine system. The endocrine system controls your hormones and things like that. Like the issue that I have with my thyroid, I had to see an endocrinologist about that. So the hypothalamus regulates body temperature, thirst, hunger, sleep, and that sort of thing. But through endocrine control, like through hormones and stuff, the hypothalamus also plays a role in regulating your blood volume and blood pressure. So that's something that I have an issue with. But because I know I have a connective tissue problem, I'm thinking the strength of my vessels might be more of the issue, more so than my actual like blood volume or blood pressure. I think my vessels are just kind of like too relaxed most of the time, if that makes any sense. So that's why I'm not able to like push the blood to where it needs to be in my body, and then I get all dizzy and stuff like that. Okay, so let's talk a little bit about the sympathetic nervous system versus the parasympathetic nervous system. So I'll start with the sympathetic first, and that one is commonly associated with that fight or flight response. I laugh because my fight or flight response is crazy, and I think it has to do with like when my thyroid's really overactive, I get like really anxious and shaky and all of that stuff. So that's the sympathetic nervous system being kind of off whack. So the sympathetic nervous system is associated with the fight or flight response, those bodily reactions that you need to respond quickly to an emergency, like decide whether you're going to stay and fight it out or run for your life. When you're faced with a life-threatening situation, your human instinct takes over, and that's when that system kicks in, and you make split-second decisions. Your sympathetic nervous system allows your body to do this really, really quickly. So, example, if you're in danger, your sympathetic nervous system will cause bronchial dilation. This allows you to breathe better while you're fighting or running away from the dangerous situation. Also, your heart rate will increase. Your heart's going to beat faster and stronger. This is also prepping your body to fight or take flight. So now the parasympathetic nervous system, on the other hand, is associated with rest and digest responses. So these bodily actions are needed to restore energy and rest the body. For example, chewing food triggers the parasympathetic nervous system to increase production of saliva and increase digestion in the gut. The parasympathetic nervous system also increases gallbladder function, which assists in the digestive process. That's interesting, I guess. I'm going to actually highlight that because I think that might be relevant to some of my problems. I'll spare the details on that. So I showed this before. It's an image. I don't know if we'll get a good photo of it, but it just kind of shows the different things that the sympathetic or parasympathetic systems control. So now that we understand a little bit about these things that are supposed to happen automatically, we can see, we can go into what happens when they don't happen automatically. And, you know, it's obviously, it can cause a major problem. So dysautonomia is actually not rare. Over 70 million people worldwide live with various forms of dysautonomia. People of any age, gender, or race can be impacted. There is no cure for any form of dysautonomia at this time, but this foundation, Dysautonomia International, is funding research to help develop better treatments, and hopefully someday there might be a cure, but we'll see. So despite the high prevalence of dysautonomia, most patients take years to get diagnosed due to lack of awareness amongst the public and within the medical profession. And that's why I'm making this video, because it just seems like I personally have been dealing with these issues since I was a kid, and nobody ever like put everything together and said, okay, this is what it's called. I kind of had to figure that out for myself. I've had doctors diagnose me with certain specific issues, and they kind of just focus in on that specific issue. They don't really look at like the whole network of issues and how they all relate. So hopefully this will help somebody and give them a term to talk about with their doctor, and maybe help them deal with some of the symptoms of dysautonomia better. Because like it said, there is no specific treatment and there's definitely not a cure, but when you understand what's wrong, it can make it a little easier to like deal with it and find workarounds and stuff like that. Okay, so the main type of dysautonomia that I want to focus on is POTS, Postural Orthostatic Tachycardia Syndrome. And it's estimated to impact 1 out of every 100 teenagers. So that's like 1% of teenagers deal with this, including adult patients. A total of 1 million to 3 million Americans are affected by this. So POTS can cause lightheadedness, fainting, tachycardia, which is the increased heart rate, chest pains, shortness of breath, GI upset, which is gastrointestinal upset, shaking, exercise intolerance, temperature sensitivity, and more. While POTS predominantly impacts young women who look healthy on the outside, researchers compare the disability seen in POTS to the disability seen in conditions like COPD and congestive heart failure. I think COPD is chronic obstructive pulmonary disorder. So POTS can be as disabling as some of these other really serious health conditions. And one of the most annoying things about POTS is that the people who have it look really normal and healthy. And then you see them like getting all dizzy and passing out, and you're like, are they just dramatic? Like, what's going on? And I assure you, I am not one of those people. I've fainted in really embarrassing situations. It was definitely not the kind of thing where you want people looking at you and you have to like leave in an ambulance and all of that. So it would be nice if there was more understanding of this condition. Okay, so now I want to talk about some of the underlying causes of dysautonomia. As you may or may not know, dysautonomia is not a specific medical diagnosis. It's just an umbrella term used to describe any malfunction of the autonomic nervous system. There are many underlying diseases and conditions that can lead to dysfunction of the autonomic nervous system. So they have listed some here, but this is not an all-inclusive list, but I'll just run through some of the different names. And let's see, we have amyloidosis, antiphospholipid syndrome, celiac disease. I was tested for celiac disease and I don't have it. Charcot-Marie tooth disease, Chiari malformation, chronic inflammatory demyelinated polyneuropathy. That sounds like something to do with the nerves. Crohn's disease and ulcerative colitis. I was tested for that, and I don't have it. Delta storage pool deficiency, diabetes and prediabetes, Ehlers-Danlos syndrome. That's EDS. That's one of the other things I want to talk about. Mast cell disorders. That's an interesting one that I was reading up on about a year ago when I was trying to figure out what's going on with me. So I'll talk a little bit more about mast cell disorders. Mitochondrial diseases, paraneoplastic syndrome, Parkinson's disease, sarcoidosis. I'll talk a little bit about sarcoidosis because my mother had that. And when I mentioned that to, I think it was the endocrinologist, he said that it's not the kind of thing that would be hereditary, but I don't know. I don't know a lot about some of these things. I don't know how to pronounce the next one. It starts with an SJ, so Sjogren's syndrome. Toxicity can also cause dysautonomia. Physical trauma, surgery, and pregnancy can cause it, and vitamin deficiencies can also cause it. So we know it's just a dysregulation of your autonomic nervous system, and these are some of the things that can cause it. So I wanted to talk a little more about Ehlers-Danlos syndrome, EDS. EDS is hereditary. It's a hereditary connective tissue disorder. In the last video, I did mention connective tissue disorders and what connective tissues are. So basically, connective tissues are found in, I think, pretty much every tissue in your body. It gives strength to your tissues. And let me see. The connective tissue that I discussed is collagen. So I said that about 1/4 of all the protein in your body is collagen. Collagen is a major structural protein, and it forms like these molecular cables that strengthen the tendons and resilient sheets that support your skin and internal organs. So your bones and your teeth are made by adding mineral crystals to collagen. So collagen is like the framework, the structure that provides strength to all these different types of tissues in the body. Collagen provides structure to our bodies, protecting and supporting the softer tissues and connecting them with the skeleton. So if you have a deficiency where your collagen maybe isn't formed properly and it's just not offering the same kind of strength to your cells, to your tissues, then you will have a lot of different kinds of issues. Some of them are benign issues, but some of the issues can be more serious. Like I mentioned that I have something called an incompetent cervix. It makes it nearly impossible for me to carry pregnancy to term. And that's one of the results of having a connective tissue disorder. So anyway, Ehlers-Danlos Syndrome, EDS, is a hereditary connective tissue disorder that typically presents with stretchy skin and joint hypermobility. So I am kind of flexible, and it can cause frequent dislocations and a lot of pain. There are some genetic tests, but the diagnosis is usually based on clinical evaluation by a geneticist or a rheumatologist. I think I probably need to get connected with a geneticist or rheumatologist. There are many variants of Ehlers-Danlos syndrome, but the most common variants are the hypermobile Ehlers-Danlos syndrome, which is type 3, and then the classical EDS, which were formerly known. So actually, they changed the classification system. So the type 1, 2, and 3 don't even really matter anymore. But those were the two most common types, the hypermobile and the classic. But there are a bunch of other types too. One of them is really dangerous. It causes this serious heart problem. Let's see. EDS, especially the hypermobile type, appears to be common in patients with autonomic dysfunction. So again, I'm pretty sure I have the hypermobile type. I obviously have some autonomic dysfunction, and like they're saying here, those two seem to go hand in hand. Observed vascular abnormalities in patients with EDS may be linked to EDS in orthostatic intolerance. So there are some abnormalities in people's vascular system, is your veins and arteries and things, and abnormalities there can cause the orthostatic intolerance, which is the inability to be upright and keep your heart rate and blood pressure regulated, and that's what leads to the dizziness and the fainting. So there's this other thing that, so cranial cervical instability and Chiari malformation are also seen in patients with EDS. So this is some kind of like malformation in your spinal cord that can obviously cause other issues. And that can contribute to autonomic symptoms as well. So that's basically what I'm dealing with the EDS. It can cause weakness in my vessels and things, and then it causes, like a domino effect, all of these other problems. I would say for me, the thing that makes life most difficult, I deal with my gastro symptoms every single day. The pain is unbearable at times, but the dizziness is something that I can never overcome. It's like sometimes I just literally have to lie down. It doesn't matter where I am. And if I don't immediately lie down, I will fall down. So that's one of the hardest things to deal with. And then the fact that I look physically fit. So it can be difficult to prove to doctors that I have a problem because they think that I must work out all the time because I look so fit. That's not the case. go through times of not eating very much because my gastro symptoms are so bad, and my anxiety and all of this other stuff. So if there's anyone out there dealing with similar issues and you're feeling alone and ignored, I can relate. Let me know in the comments section. Maybe we can figure things out together and find better medical help. That's one of the things that I'm really trying to do now, is find a doctor that I trust, because finding a primary care doctor can be difficult anyway. There just there's not enough of them. But oh, thank you, Pat. That's so sweet. But we'll see. Hopefully, I'm going to stay on this journey of trying to get healthier and just feeling better, taking it one day at a time. I have other things that I'm going to discuss in terms of like health and wellness. And obviously, there's a whole lot more I can get into when it comes to dysautonomia and POTS and EDS and all of the issues that I'm dealing with. If there's something that anyone watching this video wants me to talk more about, let me know in the comments section. Thank you so much, so much for watching. I really appreciate it. I hope you subscribe if you didn't already, and I will be back with another video very soon. I hope I can help somehow. Oh, thank you, Pat. I appreciate that. And thank you so much for watching. So that's it for now. I'll be back soon, and I will probably be going live on my other channel in a bit. See you soon.